Hello everyone, I am Dr. Mayuri Yeole. I am a DM clinical geneticist. I am currently associated with Nelson Hospital, Nagpur, providing my services for reproductive genetics, neurodevelopmental genetics, our movement disorders, and also further including your cancer genetics. Now, to begin with, what exactly is genetics? Genetics is nothing but a study which is associated with chemical instructions in our body. Now, we all have altogether nearly 18 to 20,000 of genes in our body. We have trillions and trillions of cells, and in these cells, we have 23 pairs of chromosomes. Now, these chromosomes, one comes from the father and one comes from the mother. Altogether, combining it to be a 23 pair of chromosomes, out of which we have 22 autosomes and one pair of sex chromosome, which identifies us as male or female. Now, these chromosomes, they have a ribbon-like structure binded over it that is called as DNA. Now, DNA is like a blueprint in our body, and let's just say that in this blueprint, even a tiniest of the tiniest mistake or change can result into a genetic condition. Now, altogether, we all, if we look around us, we all have 8 to 10 disease-carrying genes, but not all of us will manifest a genetic condition. It just depends upon the other partner who will have that particular similar genetic change in them. Sometimes these genetic conditions are inherited, that is, they are transferred from one generation to the next generation, or sometimes they can also happen by chance. Now, sometimes we all carry a genetic mutation or a genetic variant inside us, but it also depends upon our environment, our lifestyle changes, and our habits. Why are these genes important? Is because these genes will help us understand that how does our body grow, or how does our body respond to one particular infection, color of the hair when we grow up, or how will the hands or the foot develop, or how does one respond to a particular infection also. Now, how can these genetic tests be important? These genetic tests are basically, it helps us in early identification of any underlying condition and can streamline the treatment if at all it is available, and if there is any research that has been continued for the same. Now, how does this test happen? Genetic tests, as they are heard and as they are perceived as to be a little tedious and difficult, they can be conducted in a very simpler way by just using your 2 to 3 ml of blood sample, or by a simple saliva test also. Now, whom do we cater to, or who can undergo this genetic testing, or who is benefited by these genetic tests are people who are planning families or who have a history of genetic condition in their family. A simple couple carrier screening can help us identify if there is a probability of occurring a genetic condition in the next generation. People who have history of cancer in their family, for early diagnosis and following the treatment. Nowadays, with the advancement of research, we can also implement this genetic testing for pharmacogenetics. That is, like some drugs we know that it can be suitable to one of the family member at one particular dose, but the same dose can be either lethal or may not have any effect on the other person. So these are some of the circumstances where we can identify. Also, one more very important is that if there is an affected child and in whom we have identified the genetic condition, the most important use of this identifiable genetic condition is we can check it in the next pregnancy for that particular family by doing either chorionic villus sampling or your amniocentesis.